Well, the thought of surgery can make anyone nervous, right? If it's an elective procedure, of course, you have the luxury of time to do your research and prepare to ask all the right questions. So here to help us make those smart choices, we have Dr. Shub Das with Ohio ENT and Allergy physician. So thanks for being with us.
Thank you very much for having me.
First, let's talk about under your specialty. Name a few of the procedures, a few of the surgeries that people maybe would have.
Well, I'm trained as an ENT and then specialized into sinus surgery. So most of the surgeries I do are for people who have chronic sinus infections, have them several times a year, and they don't get better with antibiotics. Those patients come to see me. Also, people with more advanced problems like brain fluid leaks or tumors in your skull, those types of problems are typically referred to me.
So you often hear about, and this is true with every surgery, when you talk about getting a second opinion, do you always think that that is important to do no matter what the surgery is, who you're dealing with?
I think it depends. Just like in all medicines, there's a huge spectrum of the severity of your surgery. For example, in ENT, there's probably at the easiest end of the spectrum are just getting tubes, which are very straightforward, and often the skill of the surgeon isn't as critical. And then at the far end of the spectrum is probably cancer surgery, where you might have an advanced cancer, and then there's a lot of options, and the skill of your doctors is, I think, very important. So it depends. Also, if you have a relationship with a ENT, that also is very helpful. So some people have seen their doctor for many years, and then that doctor says, okay, it's time to do a surgery. You know, you might not need a second opinion because you've had a long relationship with that surgeon. So it depends, but in the cases where it is helpful, it's still very difficult for patients to be able to figure out how to find a good surgeon for their problem.
Right, and I think the relationship, you kind of hit the nail on the head with that, because that says so much about what you're doing. You trust them, you've had this relationship. So, I mean, you're right. I mean, if you already trust your doctor, go with what they say.
Right, absolutely.
So what are some of the criteria, some of the credentials when somebody is looking for a surgeon that they need to be aware of?
Well, for me, example, if I needed a knee surgery, it would be even difficult for a physician to try to find somebody who is excellent. But I typically try to look at their training, where they trained, you know, if they're college and med school and residency, or have more prestigious institutions. That gives me a little bit of a gestalt as to they might be more exceptional at what they do. Then I try to look for if this is an area that they specialize in, or if they really, what has been shown to be very helpful, if that surgeon has done that procedure for a significant portion of their career. Like
right, when it says this person has done 10,000 of these, you
absolutely.
feel a little bit better.
Right, and so I think there's a sweet spot in there where, you know, they're in the prime of their career and they've done hundreds to thousands of operations. They're not just starting out, and they're not just about to retire. Often is what I would look for.
And also asking questions. Sometimes people may think, I don't want to ask too many questions. I don't want the doctor to think I'm doubting them or that I don't trust them. Questions are good.
Yes, absolutely. Then that's one thing I could let your viewers know, is to definitely ask those tough questions. You want to, especially if you don't have a relationship with this surgeon, you want to almost put them on the spot a little bit to see their reaction. You know, someone who is secure in the operation that they're doing will not be threatened by that, will in fact embrace that, and that gives them a chance to explain why they're making a good decision to come to that surgeon. If, on the other hand, you sense a lot of defensiveness or irritation,
maybe that's a sign
yes,
to go the other direction.
Yes, and I would at least consider getting a couple more opinions.
All right, Dr. Das, I want to thank you for being with us. Of course, Ohio ENT and Allergy physicians are a great resource for lots of ailments, so all that information is on the screen for you this morning.
Thank you very much.